Hi, today we are going to discuss regarding birth injuries. If you are coming to the birth injuries, what is this birth injuries? Birth injuries or birth trauma is nothing but injury to the infants resulting from mechanical force during the delivery. What is this mechanical force like compression or traction? So birth trauma or birth injury is nothing but while baby passing from the birth canal during delivery, there may be due to pressure or compression, some mechanical force will cause some injury on the baby's body. That one we will call birth injuries or birth trauma. The injury is generally due to tremendous pressure put upon the baby while passing through the birth canal. I have already told birth trauma or birth injury is nothing but during the delivery there may be a mechanical force will put on the baby, pressure will put on the baby during delivery while passing through the birth canal. So that time if any injury is happen on the baby, we will call birth injury or birth trauma. Our easy definition: birth injury is nothing but injury occurring in infants during delivery. Next, what are the risk factors of birth injuries? Risk factors like primipara, small maternal stature, maternal pelvic anomalies, oligohydramnios. These are all maternal health issues. Next, fetal causes. Fetal causes like vacuum extraction, very low birth weight baby, fetal macrosomia. Fetal macrosomia means increase in size, large fetal head, breech presentation. Breech presentation is nothing but usually during delivery head will be the presenting part. In breech presentation, buttocks will be the presenting part. And use of forceps. These are the causes of or risk factors for the birth injuries. If you are coming to the risk factors of birth injuries, risk factors like maternal causes and fetal causes. Maternal causes like primipara, small maternal stature, maternal pelvic anomalies, oligohydramnios. And if you are coming to the fetal causes, vacuum extraction, you can see the first picture, that is vacuum extraction. Next, very low birth weight baby. You know what is very low birth weight baby. And fetal macrosomia means increase in the weight or size. The fetal macrosomia usually occurring in diabetic mother. And large fetal head. Fetal head will be larger comparing to the birth canal. And breech presentation, you can see the second picture, breech presentation. The presenting part will be usually in first picture you can see presenting part will be the head, but in second picture presenting part will be the buttocks, that is breech presentation. And uses of forceps, third picture you can see forceps. While they're using forceps or vacuum to hold or to pull the head, that time due to while pulling the pressure may apply on the baby head, due to that there may be some laceration or some some other injuries will happen. These are the risk factors of birth injuries. What is types of birth injuries? Types of birth injuries like head injury, nerve injury or spinal cord injuries, bone injuries, intra-abdominal injuries, soft tissue injuries. These are types of birth injuries. First one, injuries of head. If you are coming to the head injuries, in head injuries there may be categories like caput succedaneum, cephalohematoma, subgaleal hemorrhage, skull fracture, intracranial hemorrhage. These are the injuries of the head. First, if you are coming to the head injuries, cephalohematoma. Cephalohematoma is nothing but the collection of blood between skull and periosteum. Means cephalohematoma is nothing but collection of blood in subperiosteal. Means subperiosteal is nothing but between skull and periosteum. It occurs mainly due to rupture of small veins from the skull. For example, during it, sometimes the fetal skull and pelvis both will friction and will cause a rupture of small veins. It leads subperiosteal collection of blood. During birth will not be present, but gradually it will develop after 12 to 24 hours. It tends to grow larger, maybe persist for a week. It may be last for a weeks. And this also may be caused by forceps delivery also. For example, in that picture you can see they're applying forceps to pull the head. That time what it will happen? There may be chances of small vein rupture in the skull. That is cephalohematoma. Next, management. Vitamin K 1 to 2 mg IM in order to correct coexistent coagulation defect. So there may be a collection of blood. If you are leaving, it may cause infection. So you need to incise and you have to drain. And also you have to start with antibiotics. And some infants may need blood transfusion also. If you are not treat this properly, there may be a complication of jaundice and shock in the infants. This is cephalohematoma. Next, caput succedaneum. Caput succedaneum, you can see in that picture. Edematous swelling of baby's scalp due to infiltration of serosaginous fluid by the pressure gradle of contact. Means this one is no need that much. Caput succedaneum is nothing but it's a edematous swelling on the baby's scalp due to pressure applied on the baby's head. For example, while baby head passing from the cervix or bony pelvis, the pressure is applying on the baby's head, it will cause swelling on the baby's scalp. Or while applying vacuum or while applying forceps, there may be swellings on the scalp that we call caput succedaneum. Treatment, there is no specific treatment, but swelling may be reduced within few days. Rarely it will cause complication of anemia. Next, subgaleal hemorrhage. Subgaleal hemorrhage is nothing but collection of blood under aponeurosis. Aponeurosis is nothing but its cover inner surface of the scalp. So subgaleal hemorrhage is nothing but collection of blood under aponeurosis. Aponeurosis is nothing but inner surface of the scalp. What will be the causes? Causes like extensive pressure applied by the forceps. What will be the signs and symptoms? Signs and symptoms is nothing but it's a firm flocculent mass. There it will be increases in the size after birth in the scalp or in the head. Like you can see some mass on the head. Management. I have to monitor for the baby's consciousness, level of consciousness and HP level, and if there may be blood loss, you have to give blood transfusion. In severe cases, surgery is necessity. So catheterization catheterize the bleeding vessels. Antibiotics to prevent infection. You can see. See, caput succedaneum. I told caput succedaneum edematous swelling. Next, subgaleal hemorrhage. Subgaleal hemorrhage under aponeurosis means inner covering of scalp. Next, cephalohematoma. Cephalohematoma, blood collection. Cephalohematoma, subperiosteal blood collection. Next, these are head injuries. Next, skull fracture. If you are coming to the skull fracture, it is common frontal bone or anterior parietal bone. The fracture may be common in frontal bone or anterior of parietal bone. The skull fracture may be associated with subdural bleeding, subarachnoid hemorrhage, or contusion or laceration. What will be the causes? Causes like difficult forceps delivery and disproportion or wrong application of forceps. You can see in this picture skull fracture, linear skull fracture. You can see one S type symbol is there, no? And you can see here depressed means the line. You can see in the first picture the line how it is skull, but in third picture you can see it's little depressed inside. This is skull fracture. What will be the management? There is no treatment for linear fracture, but the depressed fracture open surgical evacuation. And if the neonates have seizures, we have to give anticonvulsant. Next, intracranial hemorrhage. Intracranial hemorrhage is nothing but subarachnoid hemorrhage or intracerebral hemorrhage. Intracranial hemorrhage is nothing but subarachnoid hemorrhage.
Excuse me.
Subdural hematomas usually result due to trauma of the normal delivery process, like excessive force applied by instrument or during breech presentation. So what will be the treatment? Treatment like replace the blood volume, how much it's lost, or stabilize cardiovascular system. That is intracranial hemorrhage. You can see, I told before only rupture of veins. See, they are using vacuum extraction. Here they are applying cup like one silicone cup on the baby's head to pull the baby's head. That time what it will happen? The deep vein will get rupture. Next, nerve injuries. If you are coming to the nerve injuries, facial palsy, brachial palsy, phrenic nerve palsy will come under nerve injury. But in brachial palsy, we have two types: Erb's palsy, Klumpke's palsy. So if you are coming to nerve injuries, facial palsy, brachial palsy, and phrenic palsy will be the division of nerve injuries. Again, the brachial palsy we will divide into Erb's palsy and Klumpke's palsy. If you are coming to the nerve injuries, facial palsy or Bell's palsy. First one is facial palsy, also we'll call Bell's palsy. What is this facial palsy or Bell's palsy? When directly we are putting pressure on the forceps blade, it causes some edema or hemorrhage injury to the facial nerves and cause edema or hemorrhage around the facial nerve. Due to that, the baby will face this facial palsy or Bell's palsy. For example, already you saw that forceps delivery. Once again, I will show the picture. You can see in this picture, when the baby head is not delivered, they are applying forceps and trying to deliver the baby's head. See, you can see when the pressure applied by the forceps on the baby's face, there may be hemorrhage and edematous around the facial nerve. It leads facial palsy or Bell's palsy. What are the signs and symptoms? Loss of movement of the affected side. In which facial nerve it's injured, that side movement will be affected. Then affected height side which remains open. And facial asymmetry, you can see that picture. And absence of rooting reflex. These are the signs and symptoms of facial palsy or Bell's palsy. And if you're coming to the management, for protecting a eye, we can use antiseptic ointment because affected said eye will remains open even during sleep also. Then neuroplasty. Neuroplasty is nothing but repair of injured nerve tissue. Sometimes this condition will disappear within weeks. And there may be absence of rooting reflex, so the baby will not suck. So we can give nasogastric or orogastric feed. Next, brachial palsy. If you are coming to the nerve injury, second one, brachial palsy. Brachial palsy is nothing but injury to the nerve root or the trunk of the brachial plexus. Brachial palsy, the injury involved the nerve roots or the trunk of the brachial palsy, brachial plexus. It can be caused by shoulder dystonia, breech extraction, hyperextension of the neck, tearing of nerve root, hemorrhage in the nerve, or simple stretching. So in brachial palsy, we have two types, Herb palsy and Plumke's palsy. Herb palsy, upper brachial plexus injured, like fifth and sixth cervical root is involved. Fifth and sixth cervical root is involved and upper brachial plexus is injured. That one we will call Herb palsy. What are the signs and symptoms? The arm of the baby hang limply abducted, you can see here, adducted, you can see here picture, and internally rotated, and flexion of the wrist. The hand is internally rotated and the wrist is flexed. And in this type of babies, Morose reflex is absent. This is Herb's palsy. Treatment, massage and passive range of motion. The recovery maybe takes place within weeks or months, but in severe injuries, permanent disability may be developed. Next, Klumpke's palsy. Klumpke's palsy, it occurred due to damage of 7th and 8th cervical or first thoracic nerve root, resulting in paralysis of hand and wrist. You can see the picture. Here the signs and symptoms, shoulders and arms are adducted and internally rotated. Wrist is extended. Their wrist is flexed, your wrist is extended. Treatment is same as Herb palsy. You can see the difference between Klumpke's palsy and Herb's palsy. See, in Herb's palsy, hand is abducted and internally rotated, but wrist is flexed. Here, Klumpke's palsy, wrist is extended. And in Herb's palsy, injury will occur in 5th and 6th cervical, but in Klumpke's palsy, 7th and 8th cervical region and first thoracic. Next, phrenic nerve palsy. Phrenic nerve palsy caused paralysis of the diaphragm. So when the paralysis of diaphragm happen, it leads means signs and symptoms like respiratory distress, nose flaring, and tachypnea. It is usually unilateral. The affected side of the lung does not expand during respiration. Management: position the baby on the affected side to facilitate lung expansion on unaffected side. And oxygen therapy, and if respiratory failure, we can give mechanical ventilation and gavage feeding. Next, musculoskeletal injuries. If you are coming to the up to now head injuries and nerve injuries we saw. Now third one, musculoskeletal injury. Musculoskeletal injury like clavicular fracture. When baby is born too quickly or baby is too big from the mother's birth canal, the baby's head can get delivered, but the shoulder and chest will get struck. You can see in the first picture. So that time what it will happen? Clavicular fracture will happen. Next, fracture of long bones. This clavicular fracture can seen in vertex presentation with shoulder dystocia and also baby with breech deliveries. Management: heal quickly without treatment, but we have to keep infant's arms immobilized for several days. Like we can apply sling to the infant arms. Next, long bone injuries. Long bone injuries like humeral fracture or femoral fracture. This humeral fracture will occur during difficult delivery of the arm in the breech presentation and also in shoulder delivery in vertex. So what it will happen, there may be a direct pressure on the humerus bone will lead fracture. Femoral fracture usually in breech delivery. During physical examination, it will reveal deformities of thighs. Treatment: close reduction casting or simple splint apply for 4 weeks. Next, intra-abdominal injuries. Intra-abdominal injuries commonly injuries involve rupture and hemorrhage in the liver, spleen and adrenal gland. Infants with hepatosplenomegaly are at increased risk for these injuries. Signs and symptoms like pallor, hemorrhagic shock, abdominal discoloration, anemia, tachypnea, food feeding, tachycardia. These are the signs and symptoms. If you are coming to the management, volume replacement and correction of any coagulopathy. Next, soft tissue injuries. Soft tissue injuries like abrasion, laceration, petachy, ecchymosis or subconjunctival hemorrhage. What are the soft tissues present in the babies? If it get injured, that will call soft tissue injuries. Abrasion and laceration, you can see. It may occur due to scalpel cuts, like while applying vacuum or forceps during cesarean delivery or during instrumental delivery. There may be scalpel cuts on the face or head. That one we will call abrasion or laceration. Management: careful cleaning, application of antibiotic ointments, and if some laceration needs, suturing also. You can see the picture. Next, petake. Petake is nothing but non-raised pinpoint hemorrhage caused by sudden increase and release of pressure during passage through the birth canal. It may be seen in face, chest, or head. Means it's not raised, just pinpoint, pinkish pinpoint marks. Ecchymosis is nothing but small hemorrhagic areas. Means comparing to petake, it is little larger. Next, subconjunctival hemorrhage, a rupture of capillaries in the sclera. When the pressure applied on the fetal head during delivery, the rupture of capillaries in the sclera will cause subconjunctival hemorrhage. You can see petake and ecchymosis. And you can see in third picture subconjunctival hemorrhage, the redness. Next, prevention. Comprehensive antenatal and intranatal care will helps to prevent or reduce birth trauma. This is regarding birth injuries in newborns.